Hello and welcome
Female
to
genital mutilation affects tens of millions of women
who
around the world.
circumcises the girls has arrived in the
pain,
village.
infertility, even death. Why female genital mutilation still goes on despite the law.
This is what a traditional bundu ceremony is here.
In Guinea, 99% of women have been subjected to genital mutilation. In Egypt,
يختنها مثلا ليله الدخله او تاني يوم.
ايه ده وكبيره قوي كده؟
lower, 28%. But the introduction
Female genital mutilation includes procedures that intentionally alter or injure female genital organs for non-medical reasons.
I remember I was 7 years old when I was cut.
There are 4 types of FGM, and its scale is from bad to worse.
The pain was intense because I was cut with a razor blade.
Type 1, or clitoridectomy, this type involves the excision of the skin surrounding the clitoris with or without excision of part of the entire clitoris. Type 2, the excision type, is the total removal of the clitoris and part of the entire labia minora. Type 3, or infibulation, is the most severe form in which the entire clitoris and some or all of the labia minora are removed, and excisions are made in the labia minora to create raw surface. Type 4 includes different practices of variable severity, including pricking, piercing, or incision of the clitoris or labia minora, or the introduction of corrosive substances into the vagina. So the question is, why is FGM practiced? Where FGM is a social convention, the social pressure to conform to what others do and have been doing is a strong motivation to perpetuate the practice. FGM is often considered a necessary part of raising a girl child properly and a way to prepare them for adulthood and marriage. FGM is also motivated by beliefs about what is considered a proper sexual behavior, linking procedure to premarital virginity and marital fidelity. FGM is also believed by some to reduce a woman's sexual desires and helps her resist illicit sexual acts. FGM is also associated with cultural ideals of femininity and modesty, which includes the notion that girls are clean and beautiful after the removal of body parts that are considered male or unclean. So how is FGM carried out?
Each girl was held down by 3 or 4 people. They held us here, and then the person cut us with a razor blade. They did it without anesthetic.
The practice is mostly carried out by traditional circumcisers who often play other central roles in their communities, such as attending childbirth and other occasions. Anesthetic and antiseptic are not generally used except when carried out by medical practitioners. In communities where infibulation is practiced, the girl's legs are often bound together to immobilize her for a period of 10 to 14 days to allow formation of scar tissues. FGM is carried out with special knives, scissors, scalpels, pieces of glass, or even razor blades. So, what are the consequences of FGM? FGM has no health benefits, and it harms girls and women in many ways. It involves removing and damaging healthy and normal female genital tissues and interferes with the natural functions of girls' and women's bodies. Immediate complications can include severe pain, shock, bleeding, tetanus, bacterial infection, urine retention, open sores and genital region, and injury to nearby genital tissues. So, what are the long-term consequences? Recurrent bladder and urinary tract infections, infertility, the need for late surgery, for example, the FGM procedure that seals or narrows a vaginal opening, like type 3, the infibulation. It's surgically changed to allow for sexual intercourse and childbirth, and sometimes stitched closed again afterwards. An increased risk of childbirth complication and newborn deaths. flashbacks, anxiety, nightmares, and a whole lot more. Some people might not have heard of FGM, female genital mutilation. So where is FGM mostly practiced? According to the WHO, the World Health Organization, an estimate of 100 to 140 million girls and women worldwide are currently living with the consequences of FGM. In Africa, about 3 million girls are at risk of FGM annually. It is mostly carried out on young girls, sometimes between infancy and age 15 years and above. So what does FGM mean in UK? FGM practice is most common in the Western, Eastern and Northern Eastern regions of Africa, in some countries in Asia and Middle East, and among certain immigrant communities in Europe and UK. Legal aspect of FGM. In 1985, the government introduced the Prohibition of FGM Act, making FGM illegal in England, Ireland and Wales. In 2003, a private member's bill supported by the government was legislated and was enacted in March 2004. The amended law is called the Female Genital Mutilation Act 2003. This made it illegal to carry on FGM within or out of UK for nationals or permanent residents of UK. Maximum prison sentence was increased to 14 years. The brutality of FGM can be easily seen in the descriptions of the process and by examining the instruments used. The shock value of the procedure is understandable to anyone with a conscience, particularly when they consider this practice is carried out without any anesthetic and in a far from sterile condition. In our contemporary world, 21st century, such practices have become a violation of human rights. Stopping it is a must action to everyone. So, let's tackle it. Let's put all our efforts together and put an end to FGM.
Female genital mutilation affects tens of millions of women
emphasises the girls has arrived in the village.
Infertility, even death. Why female genital
Women who are cut don't have any sensitivity. This is what a traditional bundu ceremony in
مناطق
Sierra
بيسألوا
In Guinea,
في بعض
99% of women have been
المناطق
subjected to
لو عرف
genital
انها مش
mutilation.
مختلة
In
ممكن
Egypt,
يختنها مثلا ليلة الدخلة او تاني
ايه
يوم
ده وكبيرة قوي
is
كده؟
lower, 28%. But the introduction of